Okay. My name is Rita Moore. I'm chair of the Portland School Board, and I'm here on behalf of the full board, which is very supportive of this effort. And I want to welcome you all here. Thank you for coming. This is a really big day for PPS and for our students. The REAHL initiative is going to be, I think it's going to be groundbreaking, and it's going to be pulling together all of the efforts that have been going on in the district for many years, thanks to our partnerships with community organizations. And we have a 5-year plan going forward that will, at the end, be a full continuum of care for students. And it's not going to come as a surprise to anybody that we have some issues with alcohol and substance use disorder prevalence in Portland, in Oregon, and throughout the United States. And this is Portland Public Schools' effort to coordinate activities and provide, a full-on prevention, treatment, recovery program for our students. And I'm very excited about all of this, and it's very encouraging to see you all here, because we are going to need all of you and more. So thank you for being here, and I want to introduce Superintendent Guerrero.
Thank you, Chair Moore, and to all of our Board of Directors and all of our partners with whom an effort like this would not be possible without your partnership, your collaboration, and your organized support. We're going to count on it moving forward. Our wonderful students come to the Portland Public Schools from diverse backgrounds. They bring a broad array of gifts and talents. Our challenge is to cultivate, unearth those, support those, develop those. They bring all kinds of backgrounds and circumstances and oftentimes unique challenges. An increasing number come to us with mental health or addiction challenges, and oftentimes a combination of both. As a superintendent and as a district, our goal has to be in educating and supporting everyone who walks into our classrooms, and to do our absolute best to ensure that positive outcomes exist and are promoted for each and every one of our students. This is REAHL, elements of REAHL. We're here today to kick off a unique continuum of care that marshals help and support from a broad spectrum of community partners, educators, and professionals to focus attention on students for whom addiction and mental health challenges are a dominant factor in their lives. You'll be hearing more details, but at a high level, we want to take on these challenges on a number of fronts: prevention, intervention, treatment, and ultimately recovery. And we want to do it in a systematic way, working district-wide and with as many willing partners as we can possibly enlist. I know that all of you in this room have put your heart and muscle into these issues for many years, and I want to personally thank you for that work to date. With this program and your continued help, we hope to bring an expanded level of support to students to an even higher level. And we have some of these champions here with us today, and we're very grateful for your work today and for being here and for the help that we're going to count on. We're fortunate to be joined by two people who have shown leadership on these issues: Congresswoman Suzanne Bonamici and Multnomah County Commissioner Sharon Myron. Congresswoman Bonamici, one of the first to welcome me here at PPS, here in my office, has been a friend, a powerful ally for public schools in her 6 years in Washington. She's also very invested in fighting the opioid crisis. She understands the devastating impact that it has on our children and youth, and I look forward to hearing from her in just a moment. Multnomah County Commissioner Sharon Myron has prioritized also related important issues: homelessness, addiction, and mental illness in her first 2 years in office. As an emergency room physician, Commissioner Myron has used her experience on the front line, caring for those in crisis, to inform her policy. She's also the parent of 2 students here in the Portland Public Schools. Please join me as we invite the first of our guests, Congressman Suzanne Bonamici. Thank you.
Thank you so much, Superintendent Guerrero. It's a real honor to be with you here today. Rita, thank you so much for your leadership on the board. Of course, Commissioner Myron, thank you for your work. And I want to acknowledge Brenda as well. We've had many conversations, and I know how important this is to you. Thank you for your leadership. I'm very excited about the REAHL initiative here in the Portland Public Schools because it's going to be some vital work, some critical work that we can use as a model to empower students who face those addiction, mental health challenges and help them overcome barriers. And as the superintendent mentioned, there are the 4 components: prevention, which is always important, intervention, treatment, and recovery. Each one of those steps is critical. Educators certainly know the barriers that students face. So many of them are facing poverty, trauma, substance abuse, addiction, either themselves or in their families, mental health, access to health care, access to housing. And as a mom and a policymaker, I certainly know about these issues, and I'm constantly considering ways that we can keep our students and our families and our communities safe and healthy. And over the last year or so, I've spent a lot of time around Northwest Oregon, the district I'm honored to represent, which goes all the way out to the coast and down into Yamhill County, hearing from people who have been affected by the opioid epidemic. Really heartbreaking stories about lives lost and families broken and changed. The stigma often makes it hard for people to get the help they need. I heard that again and again. We know that this is something that doesn't just affect a certain people. It's spread across socioeconomic backgrounds, geographic, and it's a real issue, and it means getting people access to detox and treatment, including medication-assisted treatment. It's so important. It means access to affordable, accessible health care. That includes access to providers who are trained to and able to meet the unique needs of someone in treatment and recovery. In April, I released a report showing some of the findings from my discussions around Northwest Oregon. It's available on my website. It's called Fighting for Our Communities, Overcoming the Opioid Crisis. And it identifies several priorities to fight the epidemic, including improving prevention, treatment, recovery, pain management, innovation, and also disposal of opioids, which is something I identified we needed additional steps taken. I've introduced the Safe Disposal of Opioids Act, which would create a grant program to help pharmacies cover the cost of setting up and maintaining safe disposal boxes, like the one that at St. Vincent Hospital, but there are many starting to be more accessible. They'd be funded by a small fee on the pharmaceutical companies that manufacture opioids, because they absolutely need to take part in solving this crisis. I found, especially in some areas, that disposal was not easy, and too many people had opioids in their house that were easily accessible because they didn't know what to do with them. And in some places, the only disposal site was at a police station. And frankly, a lot of people don't feel safe walking into a police station and saying, where can I get rid of the drugs I'm not taking? So certainly addressing disposal is one piece, but we do need more federal investment. We passed the Patient and Community Act, and that was a compilation of many small bills, and it was signed into law last week, in fact. It improves federal policies and resources aimed at preventing and treating substance abuse and addiction. We have a lot more we can do. It was a step in the right direction, but there's not enough funding. The Every Student Succeeds Act which I worked on in the Education and Workforce Committee, the Student Support and Academic Enrichment Grants. Those include trauma-informed practices and mental health services to support student learning. So that's another resource, but again, we need more funding. I'll continue advocating for those additional resources and fighting to protect healthcare for those, especially those in need, at risk, or in recovery. But again, there's a lot more that can be done at the federal level. I'm glad to partner with our state and local officials. But I just wanted to say, because we're here at the Portland Public School District, education is a very good investment. Our children are a good investment. They are our future, and they should be a priority for policymakers. Now, sometimes that requires some long-term thinking, but we absolutely have to have policies that make sure that every student can succeed. And, you know, the superintendent mentioned that. Our public schools take every child, and we need to make sure that we have a path and support for those students. And the REAHL initiative is going to provide needed services directly to students, and by supporting students in recovery who are transitioning back into school is going to give them an opportunity to succeed. So I'm very excited about this and seeing right here in Portland changing the direction and doing something innovative to address this crisis. It's going to take all of us working together, and I'm honored to be your partner in Congress and look forward to working with you. And we'll definitely be watching how the REAHL initiative is progressing, because there's so much potential doing this really critical work that we can replicate and expand and scale up. So thank you again to Portland Public Schools for your leadership and your dedication to really supporting all of our students and providing the additional support we know they need. So thank you again, and it's my honor to introduce our fabulous commissioner, Dr. Sharon Myron, who has been, of course, a leader in this issue as well. Thank you.
Good afternoon. Thank you so much for having me here. It really is an honor to be here with so many of you, and particularly with such a champion for our children, our youth, our schools as Congresswoman Bonamici. I can't imagine a stauncher supporter and champion of those issues. So. Mentioned, I'm Sharon Myron. I am the Multnomah County Commissioner representing District 1. That's all of the county west of the Willamette River, and then the east side, south of 84, out to Chavez, or 39th. So you can figure where that is. I am also, as was mentioned, an emergency room doctor. And it was really that experience working on the front line and seeing so much crisis, particularly in the areas of substance use disorder and mental health, that spurred me to really want to run for office and work at the policy level to address some of these deep issues that we see in our communities with regard to mental health and substance use disorder. So one of my top priorities coming into office was to improve our region's system of behavioral health care. And toward that end, I sponsored a deep systems analysis looking at our region's system of behavioral health care. And we did months of stakeholder interviews. We did data collection, we did multiple community listening sessions to hear from people, not just what the data shows, what we think our policy is showing, but the experience of the community and what people are experiencing our behavioral health system as. The people who use it, the people who work in it, the friends, family, loved ones who support the people who are in that system. And the report highlighted some really key assets and partnerships, as well as some critical gaps and opportunities to improve that system. So one of the recommendations in the report is to continue to expand access to mental health services that are school-based. Cannot emphasize the importance of that enough. The issues So it was also mentioned, I think, I am a mom of 2 Portland Public School children, a sophomore in high school and a 7th grader, 7th grade, I think still. Yeah, it's like, they're just like, a 7th grader as well. And so I know that the issues facing youth today can be extremely challenging. I remember the first time someone shared with me the fact that suicide is the 2nd leading cause of death among youth aged 10 to 24 in Oregon. And that is staggering, 10. The Oregon Healthy Teens Survey asked youth the question, during the past 12 months, did you ever feel so sad or hopeless every day for 2 or more weeks in a row that you stopped doing some of your usual activities? In 2017, 37% of 8th grade girls and 19% of 8th grade boys, and then 39% of 11th grade girls and 22% of 11th grade boys answered that question, yes. As the mom of those school-age kids and as someone who was immersed in these issues at the policy level and discussions at work, I'm not necessarily surprised to know that so many kids self-identify as feeling sad and hopeless, but the data really drives home how deep this issue runs among so many of our youth. Knowing how early mental health and addiction challenges often take root, I think it's absolutely critical that we expand our services to meet people where they're at. For our young people, that's in school. Portland Public Schools and Multnomah County are currently partners in supporting youth facing mental health and substance use challenges. And it is so exciting to see PPS articulate this comprehensive plan to provide prevention, intervention, and treatment to students. We are really pleased to continue partnering in this work, and I'm very proud that PPS is taking these steps to meet the needs of students as whole people. I would now like to turn this over to Brenda Martinek, Chief of Student Support Services for PPS, and someone I consider a visionary and a friend. Thank you.
Good afternoon. Welcome, and thank you to everyone who's here today. I see government officials, staff, administrators, friends and family, media, and our community partners who have been shoulder to shoulder with us in this work for years. I want to thank you, and I want to talk with you more about the specifics, but I think the best way to do that is to show you our video, and it might help to answer some of the questions that you have right now.
There's a real dilemma facing families in America. It's especially acute here in the city of Portland. Addiction and mental illness are affecting the lives of our students.
And I know this has been said a lot, but the stigma around mental health is so big, especially in teens.
NAMI is the National Alliance on Mental Illness. Our mission is to improve the lives of all people affected by mental illness. Fairly firm statistic is most people will have onset of their mental health disorder somewhere around 13 years of age.
We see that both mental health and substance abuse are major challenges for a lot of our students.
It's very important because personally, like in my life, I know people who have had drug problems and stuff, and some people just feel like there's not specific help out there for them.
So we in Portland Public Schools are really excited to announce our Recovery, Education, and Action for Healthy Living Continuum of Care Plan. We call it This is REAHL. It is a continuum of care for students who are facing addiction and mental health challenges. And it really has 4 key components, which is prevention, intervention, treatment, and recovery.
Portland Public Schools is going out on the kind of cutting edge as to how do we really change what we do in support of parents and kids. So in terms of co-occurring and dual diagnosis, what we're talking about is people who have a disorder in both mental health and with substances. And that introduces a significant complexity of treatment.
Prevention is beyond important, like beyond words important, because if we weren't to have prevention, we're just going to be all hiding in the dark with our problems. When things stay in the dark, nothing changes.
So 2018-2019 is the first year of our 5-year implementation plan. Currently, we've hired 2 qualified mental health providers. We've also expanded our partnerships and services with mental health providers regardless of insurance. And we're looking to offer some high school clubs or activity groups for students who want to partner with other students and stay drug and alcohol free.
So LINK is something we've established here at Lincoln about making safe decisions surrounding drugs and alcohol. I'm very interested in this topic just because I've seen how it affects my peers around me.
The idea is to kind of create this culture where we're promoting safe decisions when faced with drugs and alcohol.
You know, sometimes the posters don't work at school. Yeah, they get at people's attention, but sometimes they don't give that extra step that people do need. And so I feel like with even schools letting coalitions be made, you know, in their neighborhoods, through their schools, even having after-school programs about awareness, just different things with drugs, alcohol, suicide, anything like that, you know, it just makes the extra step feel caring and welcoming.
Peer-to-peer support and sort of this idea that people are trying to help you that's your age is just really powerful.
Looking forward, we're really excited to expand our Insights class with students and their parents. Our big, exciting goal is to open a recovery high school within a few years.
So it's really exciting to see a district like Portland Public Schools, which is large, willing to really take on what is critical work.
I wasn't trained as a counselor, and so having people who are professionally trained in those areas work with us to bring those services to students so that they can move forward in their lives is what's really exciting.
We have a number of amazing agencies that are partnering with us. They provide mental health services in the schools. Some of them are providing addiction intervention services in the schools. We've got folks doing youth empowerment groups. We've got folks doing work with families around education, substance abuse prevention education, and suicide prevention education. So we are really reliant on our community partnerships and very appreciative of them.
What we are doing is sending out a call to action for additional community partners, philanthropic organizations, and other private providers to come together with us in this work. The opioid crisis is real. We are losing children, and we need help.
LINK is important to me just because I've seen firsthand the effects of alcohol on the people around me, and I've heard many stories in the media about how it has just ruined people's lives, and I don't want that to happen to people here at Lincoln and my classmates.
It's important for me because to me, there's a lot of people around me that are doing the things that we're trying to prevent from happening, and I want them to get better.
Thank you. As we completed our internal assessment in PPS, we found some amazing work that was happening in some of our schools. But in order for us to put equity at the forefront of our work, we need to ensure that all students in all of our schools have access to real supports in a trauma-informed, emotionally supportive, and highly skilled way. Our future is bright. We have a 5-year plan to increase services with a culmination of a recovery high school, as you've heard before. Supports for our students is crucially important to their success. And so now we have 2 students that would like to talk with you, Shatiri Gibson and Kayla Ford.
Hello, everyone. My name's Shatiri Gibson. Kayla, you want to introduce yourself?
My name's Kayla Ford.
Alrighty. So I am currently the chair of Big Village's Youth Coalition, GDMA, which stands for Good Decision Making Alliance. We will hear more about that in a second, but before we get to that, I would like to talk about Big Village Youth Coalition, who funds our program and stuff. Big Village, for those who don't know what they are a community coalition led by a group of hardworking individuals who are dedicated to reducing substance use and high-risk drinking among youth and young adults. Their tagline is to create more connected community, healthy kids, and safer neighborhoods through all of Portland. They do this through looking at data and creating plans, raising funds, supporting groups, and starting youth coalitions like GDMA. I'm very grateful to Big Village and their coordinator for setting up the Youth Coalition and the opportunity for me and my friends to attend the Community of Anti-Drug Coalition of America Youth Leadership Conference this past summer in Florida. This opportunity taught us how to effectively lead in the planning for prevention programming in our community. And if it wasn't for the collaboration between PPS and Big Village, we wouldn't have gained the skills we did. Here's my colleague, Kayla.
Hello. Okay. Hello, my name's Kayla Ford, and I am currently the co-chair for GDMA. Now on to our project. Oh my gosh, I just stuttered. GDMA was established to make a change in the lives of youth and help them think proactively about their decisions around engaging in drug use and underage drinking, and its impact on their health, relationships, and the overall community. We exist to provide a place where youth can voice their own opinions, thoughts, or concerns in a judgment-free environment. A place where they can come and be educated about the resources available to them, learn their leadership skills necessary to change their environment, and have a meaningful impact on their school and greater community. One of our current projects we are working on is getting trained and completing assessments of alcohol and tobacco retailers in our community. With this information, we hope to learn more about how we can help our communities keep kids safe from the impact of drugs and alcohol.
While we know that adults are trying to get teens to change the culture of substance use, the fact is that adults won't succeed alone. We as teens need to have our own voice at the table, and we need adults to not be our friends, but rather our mentors, and think while impacting the decisions that affect our lives and our future. Thank you for listening, and have a great rest of your evening.
Thank you, Shatiri and Kayla. Your words are inspirational, and I know that that took a lot of courage to come up here, so thank you very much. I also want to thank a couple of other people that are here today. Some representatives of our board is here today, so thank you for coming. Also, our Multnomah County Commissioner Jessica Vega Peterson is here, and State Representative Mitch Greenlick. So thank you also for being here today. I also want to thank our sponsor for today's event, which is Regents Blue Cross Blue Shield. They have provided the financial support, so the wonderful, amazing pins that you have, yes, they're lovely, our journals. One thing that we wanted to make sure that we did is provide journals because it signifies the work that we do with our students. We will be giving these journals out to our counselors in our high schools, and they can provide them to students. One thing that we know when students are actively engaged in recovery, that we ask them to start journaling. And so, so it's a nice, significant way for us to be able to provide support for them. Finally, this is a call to action. We need your help. Our educational system is not funded to support the students with the intense needs that show up at our doorstep. And yet we serve them. We happily serve them. We welcome them. We serve almost 50,000 students and their families in PPS. And we can all make a difference, but we have to come together in order to do that. There are ways in which you can engage with PPS. Our handy dandy FAQ, it will tell you more about our recovery, education, and action for healthy living. It also has some links in case you would like to partner with us. If you've not signed up or given us your email, if you could do that. Later on in the month, we will be having a luncheon for anybody who is interested in joining us in this effort. Thank you to all of our speakers today. Really appreciate you being here and spending time with us. We appreciate your support. So if there are any questions from the media, I'll be happy to take them. If not, then there's treats in the back, and there's, I think there's still some cucumber water. Nice. And some tea. So thank you very much for being here. Okay. Thank you very much.